Hello class, welcome to Unit 5 where we'll be discussing biomechanical and neuromuscular risk factors. Biomechanical risk factors are a combination of risk factors that relate to the biological system and the mechanical structures, functions, and motions of the body. There are three planes of motion that the body can maneuver through, being the sagittal, coronal, and transverse plane. The sagittal plane splits the body right down the middle, left and right, whereas the coronal plane splits the body front to back, or anterior to posterior, directly down the middle, and the transverse plane splits the body in half from a top to bottom perspective. So as we're looking at biomechanical risk factors, along the sagittal plane we could have the trunk, the hip, the knee, or the ankle all playing a part along the sagittal plane. If the center of mass of the body is shifted behind the hips and behind the rest of the lower extremity, then the individual may be at a greater risk of injury. If the hip is at a greater degree of extension, then allows the body to absorb energy, and that going along with the knee as well in a hyperextension phase, where the knee is almost locked out or beyond 180 degrees. Both extension in the hip and the knee can lead to greater risks incurred. And the ankle, if you land in a heel first contact, or if you land on a forefoot but the ankle is locked and cannot drop into a dorsiflexion position from plantar flexion, then the forces can run unabated up through the knee and create increased risk factors. Moving on to the coronal plane, typically we think of this as the knee valgus position, but we also can have increased risk of injury if the trunk lands or moves into a position of lateral flexion. Also, if the hip adducts, allowing the knee to travel towards the midline, or if again, as I mentioned before, we most typically think of knee valgus positioning. Sometimes this is referred to as knee abduction. Increased risk can be incurred from that, and also ankle eversion, allowing it again allows the knee to travel inward or towards the midline of the body. Moving on to transverse plane, this has to do with rotation. So I'll first skip all the way down to ankle. Typically, the body is only limited and has forces running through it rotationally when the foot is in ground contact. So if the ankle is planted, the knee and the hip then are able to rotate but have forces running through them. If the foot is not in ground contact, forces rotating the knee and the hip will not be nearly as strong or strong enough to cause injury. Moving on to neuromuscular risk factors. Neuro relating to the nervous system and muscular relating to the muscular system. There's an interconnectedness, where the nerves control the muscular system. When we are thinking about the neuromuscular system working, it typically acts as an unconscious activation, which leads to stabilizing the joint in a dynamic manner, and it's typically in response to a stimulus. The neuromuscular system generates movement, and it also works to counter external forces that are placed along the movement chain. When we're looking at neuromuscular risk factors, the hamstrings typically are weak, and so this leads to a poor ratio between the quadricep strength and hamstring strength. And then the other way to think about it is just co-activation in general. If the hamstrings are weaker, they're not going to activate to a greater degree as the quadriceps typically do. And this typically manifests in anterior tibial translation as the tibia can shift forward against the femur, putting stress on the ACL. Dynamic joint stability, this typically manifests through knee valgus or internal rotation, and it has to do with flexibility and stiffness. So there's a relationship. Everyone talks about making sure you stretch before and after you work out, dynamic before and static after, and we talk about having tight hamstrings as being a negative thing. If the ACL is too stiff, if the tensile strength is there but it's not allowed to give, then we may be set up for greater risk of injury. However, if the flexibility is too great, if the muscles are too flexible, they may not activate quick enough when a stimulus occurs, and that may lead to, again, greater degrees of injury when the tibia translates against the femur. And finally, fatigue. It's not something we typically think of because it's something that everyone can experience. However, greater athletes will experience it to a lesser degree just because they train at a greater degree. But muscular fatigue can also prevent the muscles from activating as quickly as they may need to in order to dynamically support the joint.